Welcome everyone, and this is the panel on climate change and health as part of Climate Change Week. So my name's Rowena Ivers. What I might just do is share my screen. I'm going to run through a few slides, and then we're going to welcome some of our presenters here, and I'll do that once I get my slides up. Okay. Yeah, welcome everyone. Today, we're going to basically, first of all, I think we've just got to use our beautiful new slides of the official welcome to the uni. So we'd like to acknowledge traditional owners, the Dharawal people. We're on Dharawal country here, and all of our elders, past and present, and future leaders as well. So yeah, today what we're going to be doing is, I'm just going to whip through a few slides first, just to give you a bit of a background on climate change and health. So and then we're going to go to our panel. So I'm Rowena Ivers. I'm an academic GP in graduate medicine, and for many years I've had an interest in climate and health. And in fact, one of our panel members here, Owen Price, we were involved in an environment centre many years ago in the Northern Territory. So today we've also got a panel of Karen Charlton from Nutrition and Dietetics, some students, Isabella Todd and Phoebe Devereaux, and our research reps, which is Owen and Thomas Astell-Burt. So thanks to everyone. And we'll have a bit of an informal discussion during the panel meeting. So yeah, just I guess as a doctor, I'm very aware of the effects of climate change. And certainly we know already that, you know, between 2030 and 2050, it's expected to cause about 250,000 extra deaths per year. Could be more depending on the climate modelling. So we know it affects everything. We know it affects clean air, drinking water, food and shelter, puts pressure on all of our systems, especially in those in developing countries. And they're not able to, especially those countries of very low sea level will have huge impact. So basically it increases inequity. And we know that really global health is one of the biggest challenges we have is climate change. This is from The Lancet. They've had a great series of publications about the effects of climate change on health. And it's multi-system. So we know that climate change has a flow-on effect, and it flows on to affect agriculture, flows on to affect fisheries, it affects food delivery and supply chains. We know that heat waves and drought have effects on mental health. We know it has effect on cardiac health. And everyone knows that the stats about the temperature changes. This is one of the graphics that I really like, Ed Hawkins' stripes, with 1971 being the borderline between blue and red. And you can see certainly as the time moves on, we're getting more and more of those extreme temperatures. And I actually think some of the consciousness has changed because there's more and more days when it's 38 or 40 degrees. If you live in Western Sydney, in Penrith, it's frequently very high, and it starts to affect things like sport. It's not so pleasant to have a barbecue. It's not even pleasant particularly to go camping when it's that hot. So there's been a lot of discussion about the modelling about temperature rises under the various different policies. And I'm sure with the climate change Congress in Glasgow coming up, we'll be hearing a lot about that in the media, and the various policies that can impact on temperature rises. And what we actually need to do to change that trajectory. We know it's going to have massive outcomes. And certainly 1.5 degrees is almost a given rise at the moment, but we know that up to 5 degrees is is possible. It's possible. So we have to look at mitigation measures. So looking in health, we actually see the effects of heat waves. They're much more common, especially old people, the elderly, people with cardiac failure, renal failure, people who are otherwise unwell, like with gastro. And I've just got a picture of Kachajuta up there in Central Australia. And I was there one day when it was 48 degrees, and there was a 20-year-old who died because he had gastro. And the heat caused, the combination of heat and the gastro caused his death. Thunderstorm asthma. With rising temperatures, plants produce more pollen, there's more thunderstorms. And I myself had never had asthma. When that big thunderstorm asthma storm head came through, I actually had asthma for the first time. So now there's a great piece in The Guardian. It's worth looking up only this week. It's actually summarised their statistics really well. So I've just got a few pictures there, but we know there's floods, there's drought, there's sea level rise from Antarctic and Greenland ice shelves collapsing. And here, just for this week, we have the tornado in Armidale. So we expect to see more extreme weather events. Bushfire smoke was a big deal the summer before last, and I actually did a presentation with Michael Holland, who's one of the obstetricians down there, and we know that it causes premature births and placental problems. Some of those women around Maruya, were exposed to heavy smoke over a 6-week period. So, and we know that with bushfire smoke, it's not just Australia. That China, California, many countries around India, many countries around the world have bushfire exposure. So air pollution, and actually I've just come back from the Doctors for the Environment conference on the weekend, and Ben Ewald is a public health physician and GP. He's very interested in air pollution from cars, from fossil fuels, and this is kind of a bit of an invisible killer. We know that it causes chronic airways disease, it triggers asthma, it causes strokes and ischemic heart disease, but often those people won't realise that it's actually related to the quality of the air that's around them. So infectious diseases, certainly we see there's certainly mapping the movement of some of those vector-borne diseases as the temperature changes. And I think the ones that are relevant to us are things like dengue, moving down into New South Wales from Queensland. Zika virus is certainly possible, but in other parts was things like schistosomiasis as well. So, and you know, I guess the warm weather, it can encourage more of those insect-borne conditions. So mental health conditions, we actually, with our medical students, we talk a lot about mental health related to drought. And certainly a lot of our medical students in Wollongong are spread out around like Griffith, Forbes, Broken Hill. A couple of trips to visit students out at Forbes about a year ago. It was just before Christmas. There were huge dust storms and basically not a blade of grass. And I think financially that hits the farmers. Suicide is a very real issue in those communities. So, but we can also see the rise of eco-anxiety and young people worrying about that, perhaps affecting their plans, even have children in the future. But it's obviously financial issues for people as agriculture collapses, that can be a big issue. Again, at our conference, we had a bit of a chat about, and I guess it's nursing colleagues and are also very interested in this, is how much does our actual healthcare contribute to climate, the carbon footprint, and basically it's about 7% of Australia's economy, and a lot of that is hospital care, but it's also things like medications as well, and transport to and from hospitals and healthcare. So colleagues in this area actually doing a lot of work around reducing unnecessary care. So there's probably about 10% of healthcare may be actually dangerous, let alone not helpful. Another 10% or so is probably neutral effect. So it's reducing medical care that we don't need. But also colleagues in hospitals are also looking at gas-free hospitals or solar panels on new hospitals, or reducing all the disposables that we use in hospitals. So for example, in even our suturing kits, the ones that I use, when you track them back along the supply chain, they're actually made often by child labour in East Asia, and thrown in the bin at the end of each use, which is really ridiculous. But we know that lots of things we can do for climate change actually help our health, like active transport. Owen's here, he's a big cycling fan. It prevents obesity, improves mental health outcomes. And Karen's, here she can maybe address this, we know that a plant-based diet, or a diet like the Planet diet, which is a plant-heavy diet, is able to both, it's more agriculturally sustainable, it's actually healthier for you, and it makes you live longer. So, and certainly reducing processed food, reducing meat and dairy makes a big impact. We know a lot of the land clearing that happens in Australia is for cattle, for meat, and a lot of that is exported. So there's a few, and we've got a bit of a graphic there about all the things that we can do, the things that an individual can do. And there's obviously a lot of things that a government can do as well. And interesting, one of the things that makes a really big difference is contraception. So, and certainly colleagues, GP colleagues down at Monash in Melbourne have got a big program around long-acting contraceptives and making it easy for people to access contraception. So, and of course, all those things, yeah, reducing flights, not so much related to health. We could probably go to less health conferences and buying energy, but a lot of those things are actually related to improving health. So, okay, we might go to our panel there. I'm going to stop sharing for now so we can see everyone. So first of all, what we're going to do is maybe get Karen Charlton on. Karen, maybe we get you to give yourself an introduction. First, talking about how can climate change be put into curriculum? What's happening at the moment? What do we need to do?
Yeah, sure. Am I unmuted? Sorry. Can anyone hear me?
Yeah, I can hear you. Yeah, I can hear you. Yeah.
All right. I have put together a couple of slides, but I promise I won't take too long. So Rowena asked me to think about how we can incorporate climate change into how we teach health students. So I am an accredited practicing dietitian. I'm also a public health nutritionist. And this week I like to think that I'm a climate change warrior. So this week I'm a warrior. Next week, I don't know what I'm going to be. But I feel really passionate that this is our only chance to influence that generation of people that have grown up perhaps in a very throwaway kind of society. It's all about consumption. So a lot of things have happened between my first child being born, who's 20 years old. So in the past 20 years, her generation is completely different to my generation. I mean, telephones, we don't speak to each other. I'm upstairs, she's downstairs, I text her and she says, what's for dinner? We communicate in a completely different environment. So I think in climate change, a lot of blame is put on various sectors, various people. We blame people for being, not abiding with what we would consider sustainable behaviors. But I think for us, this is it. Like, this is code red. We know it's code red. If we don't do something now, then our children and our grandchildren have not much hope, unfortunately. So, of course, I am a dietitian, so I focus a lot of my work, in fact, probably all of my work, on food, but also how food interacts with health. I just wanted to put up a couple of slides. If you allow me to do that. I know Rowena didn't really want me to have slides, but you know what? Diets, our current diets, and I'm talking about in our kind of community, I'm not talking about low middle income countries, but generally, this is the global burden of disease data. And when we have a look at contribution of various components of dietary intake to overall risk of disease and death, diets high in salt are a major cause of death in thousands and thousands of people. So a lot of my work has been on trying to encourage governments to reduce salt in the food supply. And this is really important in places like South Africa, which is where I've spent most of my adult years, because people have gone through the nutrition transition. People don't want to have their poor diet that they had before Mandela came into power. They don't want to have to eat samp and beans every night. They want to have meat. They want KFC. So I think, KFC is loaded with sodium, of course. Scourge of Africa, I call KFC. So we need to understand which components of diet are actually causing the problem. I'm not going to go into any more detail about that, but I just want you to sort of get a feeling that our current diets are not good for health. first of all, they're not healthy. Most people in the world do not consume a healthy diet. So that's the first thing. The second thing, this where we've got to in our current diets, whether we're in low middle income countries or whether we're in a high income privileged country such as Australia, the majority of people consume unhealthy diets, which is why 2/3 of Australians, adults, are overweight or obese, and a quarter of our children are that way too. So we've kind of, the food system has morphed into this strange kind of thing that makes food available 24/7, but not necessarily nutritious food. And it's almost like we don't care, we don't value food because we throw 1 out of 5 shopping baskets in the bin. We don't even eat it, we buy it. All that energy that's gone into making that food, getting it to the supermarket, is just thrown away. So 1/5 of that is thrown away. So food has become this kind of commodity that we just assume is there for our enjoyment. However, I think it's now time to get serious, and this is what we need to be teaching our students in curriculum. You know, at the best, about 16% of global emissions are due to production of food. At worst, it's about 27%. You know, that's significant. And then there's about 5 or 10% extra global emissions that are involved with the processing and the getting it, the transport, the storage, and so on. So it's almost obscene in a way, and it's kind of an embarrassment that professions haven't been more vocal. We've let food industry describe and develop this food system that is not good for health and not necessarily, or not at all, good for the planet. So I showed this yesterday in our cooking demonstration, but really we cannot untangle health and what we eat from planetary boundaries. The two are completely interrelated. And in fact, I think that's why we've got to the situation we're in, because for our profession and for most other health professionals, we're always talking to people about what kind of food should I eat to be healthy? And we've never really considered, well, what kind of food do we need to eat to ensure that the planet has enough resources to feed the massive number of people that are going to be on the planet in 2050 if we all survive this climatic emergency. So it's almost obscene that we've got so many people that are undernourished, but we've got even more people in the world that are overnourished, that eat too much, which I think is the biggest waste of all. You know, if you're consuming over what you need, why is that? Sorry, I'm getting a bit carried away here, but trying to get a bit of emotion into it. So the food system is complex, and when we teach our students, we need to be talking about, okay, we focus on what individuals eat, but where does the food come from? How is it processed? How is it distributed? How is it sold? And then, of course, what about waste? So this is a conversation that all health professionals can have. Everybody eats a number of times a day. So dietitians are supposedly the nutrition experts, but doctors are the most respected source of information on everything, including diet. So what doctors tell their patients in terms of what they suggest is good to eat is considered to be higher or more impactful than what dietitians who maybe study 3 or 4 years or even longer and focus on food. So we should be including climate change in curriculum of all health students. And in fact, I would go further to say all students across all universities, full stop, because we can all be part of the discussion. I love to show this slide because it shows how the quality of diet, we don't just talk about having enough energy, we talk about now the quality. So we want a high quality diet, providing sufficient energy for individuals to grow if they're children or to have a good quality of life if they're adults. But how does this impact on the Sustainable Development Goals? Well, you can see most of them are here. I think 6 and 7 are missing, but essentially, if you can have a good quality diet, you can do that and still or even impact on just about every single sustainable development goal. So where we are now is number 13, of course. So if we can be encouraging people to be consuming a diet that is in line with sort of lower sustainable impact, but also it's our role to influence the industry that's producing that food. So this is a great framework, and Belinda Gibbons does this beautifully across all faculties at UOW in order to start a conversation between our students. So I think probably the most important thing is about interdisciplinary teaching, and us all saying, okay, if the doctor is going to suggest that a person eats fish 4 times a week to get their omega-3 fatty acids up because they've got a high cholesterol, is that sustainable? So it's a really complex situation. It's not black and white, but I think we need to be creating these graduates that are global citizens. They have advocacy capacity, but they also understand the science, because there is science behind this. Not all emissions are created the same. We can't say just cut out all meat, because then we'd have a massive problem of probably anemia in teenage girls. So we have to be, you know, a little bit cautious, but also giving people that knowledge. So I'm feeling like we're in good hands at UOW. And I think I might just end with this slide, which we're very proud of. This is possibly the first time it's been shown in a public space. So this is our discipline, and this is how we feel our work and our research and teaching applies to the Sustainable Development Goals. So it's probably no surprise that we focus on SDG 3, but I think I would put out that call to all teaching disciplines across our university and other universities to kind of map where they're at. Where does their particular curriculum fit within the SDGs? And it's a really good exercise for students to be able to see, oh, okay, I'm fitting in here, but that can have an impact in various other aspects. So I apologize, Rowena, I probably haven't talked a lot about what you wanted me to talk about, but hopefully that's created a little bit of discussion. So I'll just stop there. Thank you.
Thanks, Karen. And look, it's really, and again, thinking about, and we should all be thinking about how the Sustainable Development Goals fit into our teaching. But for students, we've also got to think about what they're seeing in the curriculum as well. I believe I have heard a rumour that there's a module that's being developed on climate change that all students will have access to. And that's, I believe, a work in progress. What I might do is hand over to Phoebe. Phoebe Devereaux, do you want to give yourself a little bit of an introduction and maybe have a talk about what you've seen in curriculum and what you would like to see?
Sure. I just wanted to share my screen. I just have a small PowerPoint just with a few references and stuff on it, but it's not letting me.
Actually, you may not be able to, because I think you're maybe not a host.
Okay. All right, then that's fine.
I can allow it now.
Pardon?
I can allow it now.
Okay. You
try. Yep.
Oh, great. Thank you. But while I'm doing that, I will just chat about who I am. So my name is Phoebe. I am a medical student at the University of Wollongong. I have been sitting on Code Green, which is the Australian Medical Students Association's environmental arm, basically. And I've also been sitting on the Doctors for the Environment representative for our university as well, and sat on our actual medical students, so WOMS association, which as the environmental officer, I'm not the current one, though that would be Eilish. So I can't, it's not letting me, give you 2 seconds. It just keeps disappearing. Okay, I might have to do it without it, which is fun. Okay, so in August 2020, AMSA, which is the Australian Medical Students Association, officially declared a climate health emergency. In May 2021, the AMSA and the Doctors for Environment student contingency gathered together across the nation to demonstrate the desire for greater and more meaningful action on climate change. Medical students around Australia have made it well known that they know that there is a climate crisis and it is unequivocally a health issue. For medical students, the question is no longer, is this a problem? It's what are we going to do about it? So there are no current requirements for climate change and health in the Australian medical's curriculum. DEA is currently collecting data on whether or not Australian medical schools include this topic in their coursework, and currently it appears that few medical students have this in their curriculum, and those that do are extremely limited. In my own experience, I'm halfway through my medical degree and I'm yet to receive any teaching on the topic. From speaking to students in years above and below, there doesn't seem to be anything on the horizon either. Therefore, if you're asking me what we want to know, the answer would be anything. But going beyond that, I believe that medical students already have an understanding of the effects of climate change and health. But what we really need to do is be taught what to do with this information. This is frequently observed when we get to the end of tutorials on things such as social determinants of health. The questions at the end are always, we understand the problem, but how can we fix it? Therefore, I urge those who are writing the curriculum to not just present a problem, but some actual solutions. We understand that we can't solve the problem as an individual, but what small steps can we make as clinicians to head in the right direction? So I recently attended the annual DEA conference, which focused on climate change effects on health and its solutions. These solutions ranged from governmental policy generation to individual actions. So the strategies that would be useful incorporating into the university curriculum were the individual actions that clinicians can implement while improving the health and well-being of patients. So one of these methods suggested was encouraging a more plant-based diet and active transport, which you guys have already spoken about. And this is already a scientifically proven method to improve many people's health, including those with cardiovascular disease. Therefore, it can easily be implemented and encouraged. Another suggestion was smart prescribing. So this involves considering a treatment's ecological footprint when prescribing. A study from the University of Toronto looked at the environmental impacts of 2 asthma medications. The regular metered dose inhalers were found to have a carbon footprint of 20 to 30 times higher than the dry powdered inhalers. These medications are extremely similar formulations and therefore could potentially be substituted. Another strategy is improving the health system's effectiveness via preventative medicine and reduction in unnecessary interventions, which Rowena spoke about is one of the massive contributors from the health system. So the National Prescribing Service of Australia has actually implemented a Choosing Wisely campaign. So this campaign includes health professionals asking themselves 5 questions prior to the treatments, tests, and procedures that they're going to perform. And I did have that on the side with all the questions, but that's okay. So this campaign encourages health professionals to ask themselves 5 questions prior to any treatment, tests, or procedures. This encourages clinicians to only complete tests that inform clinical decisions. And this is something that I've already seen in hospitals that it doesn't always happen. They're just like, oh, we'll just check that just in case. So this has a reduction in the number of unnecessary tests and procedures, which benefit the patient, the health system, and the environment. So these are just a snapshot of practical steps that we can take on a day-to-day basis, which can improve the health of our patients and our planet. While these steps may not change the world, they ensure that we're upholding our oath to first do no harm. We know there is a problem, we know that there are solutions, and we're asking you to help teach us how to implement them. And that's all I've got to say. Yeah, I'll see if I can get my slides through to you guys. I just couldn't quite, because I had a few pictures with the research that was included. So sorry about that. But yeah, that's anything.
Great, thanks Phoebe. And look, I'm glad to say that we have certainly some of the Choosing Wisely. I've certainly developed some curriculum in Choosing Wisely. In fact, it featured in one of the end of year exam questions last year as well for the phase 3 in terms of our OSCE exam. So, but also, and you'll be glad to hear there is a few modules that I've developed in phase 3 as well. So, but yeah, great. That's really, I think there's quite a lot of need, and we're really looking forward to the DEA project map or the curriculum. There was also some discussion about shared curriculum between medical schools on this topic. Isabella, do you want to talk about introduce yourself and maybe give us a rundown on what your experience has been in your university education and what you would like to see?
Yep, so hi everyone, my name's Bella, I use she, her pronouns, and I am in my final year of a conservation biology degree. So I'm not in a health degree, but I am in more the earth, environmental and life sciences. So conservation biology really crosses over into all those areas. So my experience at this degree would probably be similar to a lot of people doing environmental science or just a straight biology degree. I also have a background working and volunteering in the space of climate and environmental advocacy as a community organizer and campaigner as well. So I have a perspective from that side as well. So throughout my degree, there's obviously, as it's a biology degree and we do environmental science in that degree, we learn a lot about the science of climate change. We learn a lot about the research that's gone into it. So it's cropped up in quite a few, probably every subject that I've done throughout my degree, but there is always a very strong focus on the science of how climate change works, the science in terms of environmental impacts, and the science in terms of potential technological solutions, where I've noticed that the gaps are in terms of climate education in my degree and in environmental and life science degrees is making that connection from science to climate justice and climate action in a more social context. So as you've said, sort of climate change it's a scientific issue, it's an environmental issue, but it's also a social issue. This is an intersectional, interdisciplinary issue that requires intersectional and interdisciplinary solutions. And if you're going to be educating students who are going to be researching those solutions, I think it's super important that they understand the social, political, the health context that that's occurring in. And that's greater than just statistics on how climate change is affecting ecosystems or affecting human health. We need to understand the broader implications of that. While obviously I think that the environmental impacts are a reason within themselves for us to take climate action, I think it's really important that we understand the impacts on humans, and especially understanding that this is an issue that primarily affects marginalized communities and frontline communities. So not just learning the science and the facts, but then putting those in context of real people and real communities, and having those having some kind of communication with those people who are on the front lines, who are doing the work. I think it's also really interesting that everyone has brought up the need for interdisciplinarity. So if there be some sort of potential for crossover between health students and students studying environmental and life sciences, where we could have space to communicate and discuss, because I think that what I've noticed in my degree is it's sort of furthering this siloing of different disciplines when we need to be working together. And there has been some really great steps I've seen throughout my degree to kind of break down those silos. So I was involved in an interdisciplinary challenge that took students from all different faculties and put them on teams to look at issues relating to the UN Sustainable Development Goals in a local context. And I think that was a really great first step towards that sort of interdisciplinary work within the uni, which can then be carried on sort of further to as we enter the world as young professionals. So that's sort of my perspective from my degree. There is opportunity within my degree to go and do a subject on environmental law or environmental ethics, but those subjects aren't compulsory. And while I found them incredibly interesting and valuable and definitely broadened my perspective and deepened my understanding of these issues, I think that a greater effort probably needs to be made to weave environmental law, environmental ethics, in health and climate change into all aspects of these degrees, so that we can produce students who understand these complex issues interdisciplinarily and intersectionally. So yeah, that's all I had really to say.
Great, thanks, thanks, Isabel. And I think it's a flipped version of what do health students need to know and what do science students need to know. I think in the end, it's about working together. That's great. And I know actually just listening to some of our medical colleagues talking about their work on promoting sustainable practices within hospitals, including, commenting on the new buildings that they've actually used colleagues who do modelling and look at different ways of in design, environmental friendly design in hospitals. So looking and working collaboratively. So, okay, now over to our researchers. And as a university, both the students and postgraduate students and our academics, we have a role in research that can, help prevent climate change and mitigate climate change and mitigate the health effects of climate change. So I might hand over first to Owen Price. Owen, if you give yourself a bit of an introduction, and maybe it'd be great to hear about your experience as a researcher and perhaps how students from undergraduates all the way through can consider climate change research with its relation to health. And perhaps if you've got any ideas for great places to get funding or support, that would be great too.
If only. Thank you, Rowena. Yes, so I'm Owen Price. I'm the director of the Bushfire Research Centre that's in the School of Earth, Atmosphere and Life Science. And we've been here on campus for about 15 years now doing our research with money from, generally speaking, from state government funding, and because they're very interested in how you manage this whole bushfire problem. So I'm going to tell you a bit about how we understand climate change's role in bushfire and what the research questions are, and trying to focus on those questions that relate to health. And then hopefully I'll answer Rowena's questions about, well, how you could get involved. So the first thing is that I think we've known for a very long time, like decades, that climate change will impact fire activity. And it's really because fire is quite strongly influenced by weather. So it's influenced by the temperature and wind speed and also recent rainfall. And because all the predictions and the evidence suggests that these things are changing, temperature, rainfall, etc., bushfire ought to be increasing. The problem is that when you search for evidence that bushfire actually is increasing, it's quite difficult to find. And that's, I mean, from our point of view, scientists, we like to consider things in very statistical evidence base. And you're dealing with certain events like Black Saturday, for example, in 2009. It was a monster fire and killed lots of people, but can you prove that was to do with climate change? Now, the reason I bring that up is because I think the Black Summer fires of 2019-20 were our proof. I mean, possibly not in a statistical sense. You still have some uncertainty, but they were unprecedented in so many ways. And we were record drought, we were record hot weather, and produced a record area burnt by at least twice as large in areas as we can figure has ever been burnt in at least European times. And also the research that we did for the inquiry in New South Wales showed that it also wasn't because of something else. For example, it wasn't because of fuel buildup. So climate change is the culprit. Now, having said that it was the core, it was one of the main drivers, I would just say a word of optimism, and that is those fires probably were not the catastrophe in ecological terms that a lot of people think they were. And so a lot of the post-fire monitoring of animals and plants has found that the vast majority of them survived, and there's a lot of recovery. That's not to say it wasn't bad. It was bad, but it wasn't the catastrophe it was that people sometimes think. Because of this climate change influence, we do expect major bushfire events to become more common, but that's not the same as saying it's going to happen within 3 years. It's just going to be more common. We can't predict exactly how that's going to pan out. it's quite a complicated story, because although, as I mentioned, like temperature is obviously, we can predict temperature is going to rise in a fairly predictable way. Rainfall is much more difficult to predict. And so we don't know whether Eastern Australia is going to get drier or wetter. But what we do know is, even if rainfall stayed the same, because temperature is increasing, there's less moisture available to plants. So there's going to be drier. So there's probably going to be more fire from that point of view. But then there's a flip side to all this, and that is that the increased CO2 in the atmosphere enables plants to grow faster. And so that might mean that there ends up being more fuel available for fires. And there's just complexities that are really difficult to fully understand. And so that sort of brings in some of these research questions. And there are so many research questions, things like, well, how is all that going to play out? So improving our understanding of what these future climate scenarios are, what's going to happen to plant growth, plant death, plant susceptibility to fire, which plants are going to suffer, what ones not, which animals, all those kinds of questions. But if I focus on things to do with health, the thing about bushfires, more people are killed in bushfires by the smoke than by anything else. So really, from a health perspective, it's about smoke. And it's not even just the direct health effects. There are huge mental health effects from the 2019-20 fires, which I think we pretty poorly understand. So, so most of the health related research is around smoke, and I think some of the questions would be, there's some of them are physical questions, like, well, how much smoke is produced? Where does it go? It's still not even very good at understanding where it's all gone. And one of the things that we do research on now is how you could use prescribed burning, which is deliberate burning to reduce fuel, to reduce the smoke impacts of bushfires. The problem being that the prescribed fires introduce smoke of their own. So it's a very difficult thing to answer. And other questions might be, well, what do we do about warning people that smoke is on the way, and how do we encourage them to actually take notice of those warnings? Understanding who exactly is at most risk. So some of your other folk have mentioned that people at low socioeconomic status are probably the ones most exposed to smoke. Comparing the health risks of having a short burst of very high concentrations of smoke compared to an elongated exposure to low levels of smoke, which is one of the things that happened in 2019-20 fires. From almost like they weren't acute exposures that people, say, living in Canberra got, but they were exposed to them for such a long time. Maybe that's a real problem. Yeah, so that's just a snapshot of some questions. Now, if you're interested in bushfire, in the bushfire science, we've got opportunities in our group for honours students and PhD students. I think if you want to do some of those health-related things, that's still quite possible, but it would be sort of a partnership between our two faculties. You might have two supervisors. Come talk to me, maybe go talk to Karen or Rowena. There's lots of things we could set up, especially any of those things that I've mentioned. As for funding, the main bodies that fund bushfire research tend to focus on the physical things, like how do you reduce risk, that sort of thing. Not so much on the health, but they are open, especially where the intersection with the whole social science comes in. Who's affected? How do you convince people? What can you do about it? And I'd say, of course, even the big amounts of money that's available in bushfire pales into insignificance with the money available in health research, which I know very little about. So I'll leave it there.
Great, thanks, Owen. Yeah, and look, it's great to think about the effects of smoke and the research that's happening around the health flow-on effects. And some of them some research can be done at quite a small projects. I'm aware that, say, that Michael Holland from Maria, that he was, for example, looking at routinely collected data around the time of those 2019 to 2020 fires to look at, I think, placentas, which are after a baby is born, are weighed, and it's recorded routinely in electronic medical records. Women were exposed to smoke for quite a, for periods of time, like 6 weeks or 2 months, to look at that. And I think that, again, another public health researcher that I know, Faye Johnson from the Territory, she's done a lot of work around the effects of admissions to hospital when they're, depending on the level of smoke in the air. So, and at the same time, some of the social worker and clinical nurse consultants down in Milton Hospital, where we have some of our hospitals, they developed their own resilience and wellbeing program around the time of the fires. And we're looking at some evaluation around that. And I also know, obviously, Narrow and Nudgee has a program around that whole period of time, looking at Aboriginal communities' response to disaster in that area. So there are opportunities. Certainly in the fire and air quality space, yeah, we know it has a very big flow-on effect. Okay, probably to another side of the effect of the link between climate change and health is we will speak to Thomas Astell-Burt, who focuses on, he might like to introduce himself and talk about his own research. Thomas.
Sure, thanks, Rowena. Well, yes, my name is Thomas Astell-Burt. I'm a professor of population health and environmental data science and an NHMRC Boosting Dementia Research Leadership Fellow. And basically, I'm interested in how the environment influences our health and what we can do about it. And by the way, I just want to say how wonderful our previous presenters are, but especially the energy enthusiasm from Isabella and Phoebe. I reckon if we were there in person, in front of a big audience, there would be people standing up and cheering, saying, yes, you should be our future leaders. So we're looking forward to meeting you in person and doing exactly that, hopefully not too far in the distant future. So we have in Wollongong a huge range of climate and health and environment and health range projects, and I could go on for donkey's years about all that. What I'm going to do is focus on a couple which have been run out of the lab, which I started, it feels like 200 years ago, but it's about 5 or 6 years ago now. And I started it with Associate Professor Xiaoqi Feng, who's been a long-term collaborator. So in PowerLab, and this is our website here, we've been doing a lot of work around environment and health and its impacts on our health and what we can do about it. We're not only supporting Climate Change Week, but we try and align all of our research with at least one or maybe many sustainable development goals. So our main aim is to try and do research which helps lead to policy that creates fairer, healthier, and greener cities for us all to live in, especially the greener part, because that not only influences health, but also influences the planet as well. So when I say we and us and all the rest of it, it's genuinely a team effort. PowerLab, what we've been able to develop here is a genuine collaboration between 2 universities, ours, UOW, and also UNSW. You could say collaboration is in our DNA, and we're really interested in focusing on the health impacts of cities, both major cities and also regional cities. It's a wide and diverse research staff and students who we've been able to build up and empower to do these types of research over time. And it's so wonderful that people come from all over the world to work with us, to learn with us, because they bring their experiences and help us to do better research as a result. Projects include environmental exposures like green space and air pollution and transport access and food environments, and how all of these factors may conspire or empower us to have better health across the life course. Birth weight, child development, pregnancy outcomes, loneliness, road safety, disease prevention and control, healthy aging, and healthcare use and costs. Environmental justice is at the core of everything that we do, because we want to try and level up the playing field and not just say, you know, the current inequities are fine. They're not. We need to change that. And that's why it's central to our work. How could you potentially be involved in this? Well, as you can see, we have quite a diverse student population here in PhD and at honours level. How would we get involved? Well, one of the ways in which has worked pretty well in the past is to get in touch and come on board for some form of short project or summer internship. That's worked really well in the past. Elise and Christian and Amy here were honours students, and they all started off with internships and then building up in their undergraduate degrees to do projects with us as part of their semester work, and then moved into honours degrees, and all have gone off to fantastic careers, some including working for the government in Canberra, the Australian Institute for Health and Welfare. So it's a fantastic way to get started. And of course, if you want to carry on doing PhD, that's fine too. We do offer opportunities for internal funding, often through our grants, as well as through the university system for PhD stipends. That's not the only way. For instance, one of our PhD students here, Gideon Merowitz-Katz, he's actually a part-time PhD student working in Blacktown Hospital over in Western Sydney as part of their diabetes unit. So he brings in a whole wealth of interest and expertise, which we wouldn't get if we only focused on people who are getting these scholarships internally. We're trying to be as flexible as possible and bring in people from as many different backgrounds as possible. So with that, I would like to suggest that this work has been impactful, and we've had impacts on local urban planning strategies and health strategies as well. And we could go on about that for, till the cows come home, but we're not only about having impact on policy and practice, we're also trying to have an influence on capacity strengthening within our community in UOW, in UNSW, and with all of our collaborators in Australia and around the world. And so this involves, for example, running regular journal clubs, seminars, which we call power talks, skills workshops, which we call power tools. We should really get funding from Bunnings to do this. And then PowerFest, which is basically our big annual conference, which we've run for many, many years now, and inviting grand speakers and emerging experts from all over the world so we can share ideas and do innovative research and make friends along the way, so we can do things which actually make a difference, not only here, but in other places as well. If you are interested in knowing more, well, of course, get in touch, look at the website. I'm going to raise an opportunity with you. We were recently funded to do a big international collaboration with a university in the US and also in the UK. And our study is called Less Netflix, More Nature. And it kind of does exactly what it says on the tin. We want to get people outside to enjoy the benefits of breathing in fresh air and getting into nature, and the mental health benefits, the social connection benefits, the physical activity benefits that can be brought. How would that work? Well, we're trying to think about this in terms of how can the health sector champion people to get outside more through, for example, nature prescribing. This has been done in the US for many, many years now. It's just started in the last year or so in Canada, and we're talking about it here, but we haven't started yet. We want to start. We want to get ahead of the curve, and you could be part of that. So if you want to, we're going to have some vacancies coming up, so watch this space and reach out. I'm going to stop sharing there, and I thank you for your time. Thank you.
Thank you, Thomas. Great to hear about all your work, and certainly some of the work in Blacktown through the Western Sydney PHN. A few long-term colleagues there, Dia Haller and a couple of the GPs have been long-term, been involved in diabetes care for long-term in Western Sydney, and promoting physical activity, healthy diet in those kind of areas. It's a great thing. I love reducing Netflix. That is great. And actually, I think on yeah, I think another example is I've had a cluster of students, some who were just finishing, but we've been doing some work about reducing soft drinks. And we know that soft drinks are very bad for your health and actually cause probably one of the major causes of diabetes in the long term. So very little work has actually been done around soft drink. We know that they're basically nutritionless. They also come in aluminium cans, which are not great for the environment, and they have a lot of, require a lot of refrigeration as well. So just small things. I guess another area is Karen and I are doing some work in breastfeeding and hoping to have a few students involved in that. And again, we know that's actually good for health, but also good for the environment as well. So We actually thank you, Teresa. I can see there's Teresa Larkin's made a comment that we should have soft drink guidelines. It's actually very political. The WHO has a sugar guideline, and I believe there's quite a lot of industry lobbying that went in to keep it at about 10 teaspoons of sugar. Basically, it's quite a high level of sugar. I don't believe it's an evidence-based guideline. So great. Okay, I might just open it up now and see if there's any questions from the audience. And I think we've got a small enough group where we can actually, if you feel like putting on your mic and introducing yourself and asking a question, and perhaps addressing one of our topics, what should we do in curriculum? How can we expand our research in this area?
Rowena, I might ask a question if that's all right. I think this has been a great session actually, and it shows capacity within URW across various disciplines that impact on health. I think after the excitement of this week, we don't want to go back to just status quo. We teach our students, they don't connect with other students. So, I mean, the question is, how do we change the status quo? How do we do things differently so that all of this great expertise can be harnessed? And it's probably not a question for Rowena, it's probably a question for our executive of the university. But it seems to me that, you know, especially from the two students that spoke today, there is this willingness and this need to be able to talk within disciplines and across disciplines, but it doesn't always happen that way. So I don't know if anyone's got any ideas.
I mean, again, it's one of those things that is a focus of some of our medical training, is cross-disciplinary training, and we're actually learning from each other, but also learning together. And I think it's, and finally, there's lots of commonalities between what students and what we need to learn and what we later need to research. So yeah, lots of opportunities there. I think again, a lot of it is about mapping where the curriculums mesh, and where and again mapping where research interests mesh as well, and rather than keeping in our own silos.
Trying to find that sort of university kind of infrastructure support to give academics like you all time and workload recognition to work on interdisciplinary curriculum that are linked to the SDGs. That would be amazing, wouldn't it? You know, to drive
it would be amazing
on you.
Yeah. Okay. Well, look, we've got to 5 o'clock. If we don't have any more questions, again, look, thank you to everyone for their enthusiasm and their commitment to this area. We look forward to more conversations. And I think it is, if there's for students out there, I think it is about talking to your academics and having a look at the curriculum and thinking about ways it can be worked in. And I think as academics, we need to actually, and it is taking that time to review our own content, and really we're actually doing a review in medicine of the Sustainable Development Goals in there. But I think it's about really thinking about learning for the future. And learning, you know, we not learning about the past, we actually need to plan for the future and plan for what students are going to be doing over the next 40 years of their career. So, okay, thank you. Yeah, Phoebe.
Sorry, I just did have something to add to that question that was just asked before. So when I was at this DEA conference, and a lot of things that we discussed in terms of making changes in a hospital wide was when we're building hospitals or we're redoing hospitals, ensuring that there is some kind of sustainable goal. And that way no one can question you when you're like, we need to use renewable energy, because you've got to be net zero or something like that. And so something similar, I think, in terms of our curriculum for all, but especially health aspects of having, like, we have these outcomes we have to meet, and having sustainability, or for just in medical degrees anyway, including some kind of sustainable outcome somehow intertwined in the curriculum, because it's not necessarily that we just need a lecture on how climate affects the health of everyone. It's more, it needs to be intertwined with everything that we talk about. So I know Teresa Larkin, for instance, she has a lot of really amazing lectures, and she often adds in some kind of real world examples and stuff like that. So intertwining things into different kind of lectures like that, for even with the asthma example that I used, rather than just like one like lecture, I guess, and that makes it more engaging and more practical as well, and hopefully as well less time consuming on people like you, Rowena, or our lecturers in general, because they do a lot already. So that's how I have seen could potentially be a way to include it.
Great. And Phoebe, you can start thinking about your research project your MD research project next year. Think of some good topics. That's right. So yeah, great point. Okay, thanks again. Thanks, Isabella. Thank you, Phoebe. Thank you, Karen. And thanks, Owen and Thomas. It's been great to catch up today. And hopefully we're feeling very inspired and ready to take action.
Thanks, everyone. Bye.
Thanks, everyone. Bye.
Thanks, Rowena. See you, everybody.
Bye.